On October 24th, 2008, we held a huge celebration in honor of the 40th year of the heart transplant program. Dr. Shumway had done the first heart transplant in the United States 40 years ago. The occasion was a transplant patient reunion, and this is a tradition that started about 20 years ago with a very small potluck supper party for which I made the tablecloths and the decorations. It was attended by about 10 patients and family members, and several cardiologists and surgeons dropped by. The gathering seemed so important and meaningful and significant to everyone who attended that it became an instant tradition. And we've had one of these transplant reunions every year since. The event has evolved into a much larger one, attended by several hundred patients and families, both from Stanford Hospital and Packard Hospital, as well as many of the physicians and nurses who take care of these patients. Many members of the medical staff also bring their own children and spouses to this event. The primary purpose of this big party is for patients to meet each other and to share experiences and feelings, and many relationships develop at these events. One of our newer traditions is to have a wonderful, creative, expressive art project, of which the favorite one currently is to decorate large paper mache hearts. Children and adults, family members, sometimes even members of the staff, all participate in this with beautiful results, as you can see. It's a project that anyone of any age can do. Recently, we've also had many patients or family members who play an instrument come and have an informal jam session with hospital musicians. This year, we had a symposium during the day where many physicians spoke, but also many transplant recipients spoke. And I see in some of these pictures a number of the people who actually spoke during the afternoon. One is Molly, who received a heart transplant when she was 23 days old. She's now 18 and in college and has her first job. When Molly spoke, she said, "I don't remember anything about the transplant. I've just had a normal life." And that, of course, brought down the house. Another person whose family spoke, and he put in a guest appearance, was that of Peter, whose father talked very beautifully about his transplant experience and how Peter has had in his brief life to learn how to walk 4 times, most recently because he had recovered so beautifully from the transplant that he broke his leg on a trampoline. Another notable guest at this party was Lizzie, who came with her family and her boyfriend. Lizzie was the first young child to have a transplant, certainly at Stanford, possibly in the world, and she was 2 years old. She's now 26 and has a job that she loves in Palo Alto. Lizzie wrote an essay about her experience for her personal statement when she was applying to college, and it has a wonderful beginning. She said, "I take drugs, lots of drugs. It's not because I'm an addict, but because these drugs are what are keeping me alive. I know it was quite inspiring for many of the new families, people waiting for transplants and people who are newly transplanted, to meet some of the longtime survivors like Lizzie or Molly and many, many others, especially because they're in the middle of all these intense, scary experiences, having biopsies, worrying about rejection. And to see someone who's gone through those and survived is quite wonderful.